Black and pregnant. Is it a death sentence? Nationally, Black women are 3 to 4 times more likely to die during or shortly after childbirth. And in some cities, that number skyrockets to up to 15 times. Right here in my city, New York, it's between 9 and 12 times. Unacceptable. And even before birth, we as Black women are disproportionately affected by conditions such as fibroids that are one of the leading causes of infertility. This is also compounded by the fact that we have worse access in terms of our access to advanced reproductive technologies is very different than our white counterparts. So when we look at this, we think about reproductive justice. Reproductive justice is about us, Black and brown birthing communities, requiring the equal access to information and solutions. My guest tonight is fertility specialist, Dr. Tia Jackson Bey. Tonight, we're actually going to be speaking about Black women, fertility, and maternal mortality. Very fitting. Today is actually the last day of Black Maternal Health Week. And it's also the intersection of, we're about to go into National Infertility Awareness Week. So who better to join us than Dr. Tia Jackson Bey, who lives and works right in the middle of that intersection. So before we jump into the conversation, I want to welcome you to DETOX Living, where we bring you tips, truths, and testimonials to power your toxic-free living. I'm your host, Coach Gessie, health activist and founder of thedetoxnow.com, a holistic health platform provider of education and supplements to help combat the obesity, chronic disease, reproductive health damage, as well as other issues that lead to lower life expectancy rates. So I'm going to bring on our guest for tonight. Girl, that was so fast. I was about to get into the hot topic of Ashanti declaring that she's pregnant finally.
I didn't see that.
Woo, girl. Yes, girl. I've been like,
so cute.
I was like, can we be public with it yet?
We're excited for her and them.
Yes, and them, Nelly, you know, we love you too, but we love Ashanti. And, you know, I said it's the kind of birthing joy that we need on the last day of Black Maternal Health Week. Right?
Absolutely. I agree.
We needed that joy. We needed that joy. And I, you know, as I was talking about and introducing you, first of all, thank you for taking the time to have this conversation. It's been a long time in the making.
Oh my God, it has. You know, we reached out a while ago and wanted to get it done. So I'm so glad that we could make it work.
But timing is everything. And I was just saying how you really do live in that intersection of Black maternal health and Infertility Awareness Week, right?
Absolutely.
Those 2 weeks, like you are literally the embodiment of that intersection,
Absolutely.
Right?
This is a busy 2 weeks every April. But you know, it's sincerely a pleasure to be in this space and to be able to kind of bridge the gap between the two, for sure.
Yes. So I love to start by, you know, allowing people to get to know who you are. So I said that and help them understand why. So who is Dr. Tia Jackson Bey and what do you do?
So I am Tia Jackson Bey. So nice to meet you all. I'm a reproductive endocrinologist and infertility specialist. And essentially what that means is I take care of people who are looking to get pregnant for, you know, various reasons. Either they're looking now and they're having trouble. And so we try to figure out why are they having trouble? What kind of ways can we help them to achieve pregnancy? Some people come to me because they're curious about their fertility and they want to know and they may not be ready yet. And we kind of talk through that. Other people may come because they actually know that they want children, not ready for it right now, but want to be able to plan for the future. And, a big portion of that is doing fertility preservation.
Yeah.
So, freezing eggs, making embryos, freezing them for later. Sometimes there's a medical reason, like they need a surgery or, something like that, or even cancer. Yeah. And then sometimes it's just planning your life, and that's totally fine too. And it's something that, I'm really passionate about, making sure that women know that they have this as an option and take advantage of it.
I love that. So the three different areas I heard you talk about was number one, people who are having challenges, yes. Right? So the technical definition of infertility is not being able to conceive within a year, not using contraception, right?
Right. So we actually updated the definition of infertility, because not everyone should have to wait a whole year. So
I was just going to say, but I cut that to 6 months. I was just going to say, I say no more than 6.
The majority of people will achieve their pregnancy in the first 6 months of trying. So that's kind of where we get, 6 months. Yep. And then if you give it a year, sure, they should have a good chance of success, like 85%. But what that doesn't take into account is, what happens as we get older. Right. And so we know that, age alone can have an impact on fertility. And so that's why for women 35-year-olds or older, we say no longer than 6 months.
There you go.
Honestly, I say for women 40 and over, you don't have to wait anymore.
No, wait.
Come in right away and let's see what's going on. Let's see if there's an issue that maybe we need to really stay on top of as you start trying.
I love that. So wait, before we go into the other one, I like that because that really went into your second one, which was people who are, planning to conceive, yes, right? Right. So I love that. And, I actually, my husband and I were talking about this today because we were listening to a video, a doctor that was on the news, Dr. Camila. Mm-hmm. And she was saying how it's really important to, and I stress this, if you are, number one, if you're in a relationship and you are thinking about, meaning like, down the road, you should both go get tested, right?
Absolutely.
Because right away, you don't know what factors could be playing at risk, in terms of whether it's male infertility factor or female infertility factors, right?
Yeah.
So,
and there's absolutely, doing a kind of reproductive health check-in, check-up, a lot of times unveils things that people had no idea. We talk about this all the time, but I can't tell you how many times I've diagnosed uterine fibroids or endometriosis or even PCOS, where sometimes they had symptoms, sometimes they had none at all, but it comes up and people are just shocked because no one told them.
Right.
Similarly for men, I think we take it for granted, and socially we always try to think of infertility as a burden on women. But, there's a lot of male factor infertility, which means that there could be impact from their sperm number, sperm count, sperm function in terms of how it swims. But I was going to go back to definitions of infertility because it's really important now. Just last year, it was kind of expanded to say that if you need assistance to get pregnant, say you're a single person or you're in a same-sex relationship or queer trans couple, you need whatever your relationship doesn't have, be it sperm, eggs, or uterus, then that also kind of constitutes you in this bucket. Not to say that you're infertile, but from an insurance standpoint, that means that you should also be entitled, right, to coverage, which is super important because
that is a major change
that they didn't have before.
That's a major change. Yeah. I can see bonus moms, I can see choice moms making decisions as well that, that I want to conceive, I want to use advanced reproductive technologies. Right. And now that makes it accessible based on what you're talking about, right?
Exactly. Yeah.
And then that last bucket that you spoke about, which is really important as well, especially in this world where people are waiting longer and longer to conceive, right? And this has many factors because number one, especially as Black women who up to 90% of us, battle fibroids by age 50. And usually it's within that 35 window, right? Around 30, 35, where they're really dealing with fibroids and reproductive age. If you are typically speaking, and definitely chime in here, that the longer you wait, the more symptomatic fibroids tend to be, right? And then they can become issues with respect to fertility, right? So that means that there are more women waiting to conceive later. Really, the idea of planning for your fertility ahead of time with the preservation, the egg preservation, meaning, ahead of time freezing your eggs, right? That is more and more something I say to everybody. I say, have you thought about it? What's, and with our good friend Calais, who's, partnered with Evite to create the egg shower. There's more and more options in terms of funding it, right? Have options to not take on that load all by yourself and allow your community to support you in your desire to plan for your future, your fertility in the future.
It's super important. One thing about doing something like egg freezing or embryo freezing is, a lot of people just don't think about it as an option, whereas it's been available for the past 12 years as a non-experimental, thing that anyone can endeavor upon. It didn't typically have a lot of insurance companies that would cover it. And so it remains, a largely out-of-pocket expense. But it's, like so many other things that we are willing to make an investment in. It's an investment in your future. It's an investment in the
Birkin bags. We buy and that's what I love about what Calais said, right? It's like how many times, you have a birthday or you go to baby showers all the time and you go to wedding, bridal showers and you give all these gifts. And then why is it that to get the support and the love, you have to wait until after when you're conceiving, you're having issues? Why not have the support? It's like, you know what? Instead of us going on a girls trip, I would like to freeze my eggs.
Yeah. And do kind of a crowdsourcing. So it's definitely, it's a new world. I would say for people who are delaying their family planning, you're not alone.
That's right.
The average age of first baby in this country crossed 30. It made it to 30 out of the 20s in 2022.
Wow.
And this is now the third consecutive year where the average age of first delivery is age 30. And so this is a huge cultural shift if you think
about
a whole
decade.
When our parents were having, their pregnancies, when our grandparents
they were in their teens, child. They were in their teens.
Late teens, early 20s, and were well on their way. And now many people are waiting until their 30s, even 40s to build their family. So I say that because I don't want anyone to feel like it's only them. No. This is a cultural shift that we're seeing around the world.
Yeah.
The conflict that we're kind of up against is what happens within your body.
Right.
And so there is a very real timeline, unfortunately, with your ovarian function, with the number of eggs you have and the quality of eggs over time. Those things do decrease. Now, taking care of your body is super important in order to try to help support that.
That's
but we really don't have a way to turn back the hand of time.
No.
And so by doing something like egg freezing, you can kind of, you take a Polaroid, that's that moment in time.
Snapshot.
You snapshot it in time. So if you're freezing your eggs at age 35 and you don't end up using them until age 40, your chances of success should be closer to that of 35-year-old, not a 40. So that's super important. You talked about, fibroids and when they tend to rear their ugly heads.
Yep.
And it is a very, very common issue in Black women for sure. Yeah. One study, one of my mentors does a lot of fibroid research and actually found that fibroids present earlier in life for Black women, women who had no symptoms, none at all, and were in their late teens, early 20s could actually see evidence of early fibroids on ultrasound. They also tend to be more symptomatic sooner. Absolutely. So the typical training is like 40s, fertile, you have fibroids. Well, we see a lot of women who've not had babies before, who are in their late 20s and 30s with, large fibroid burden, which is just so different.
It is. And then let's talk about the systemic racism issues where so many of them are being offered, told they need a hysterectomy without even other options. Yeah. Like, boom. Yeah. Okay, stamp up, boom. Let's do hysterectomy next.
That's a problem. And that's why we really advocate for, one, being connected with your body. We talk about this a lot, right? You have to listen to what's going on inside of you. You have to listen to your body. so many times I'll have, someone, we're doing an exam, I'll take their hand and put it on their belly. Do you feel that? Do you feel
Excellent.
that hard thing moving around? That's not normal. Feel the other side. It's soft. And so knowing what's going on, questioning what's going on, and then finding somebody who listens to you, who takes your concern seriously is important.
I love that, because what you just described is a partnership, right? When I tell our detox lifers, right, our family, I tell them, our clients, that when you go into a physician's office, and this is just what you described, that there are two experts in the room. You are the expert on yourself.
That's right.
And the physician is the expert on their field, their specific specialty, right?
Right.
And never, ever give time to a physician who's going to dismiss your voice, who's going to devalue your voice. Right. So I love that for you, the way you just communicated that it's a partnership, that together we are knowing and learning what's going on with your body. Because if I don't know and I don't listen to my body, you can steer me the wrong way, right? If you're not listening.
And I think, I talked about this a little earlier today too, and earlier this week, is I think we do have that ability to kind of listen to our bodies. I think, if you ever have been around young people, children, they're incredibly in tune with all aspects of their body and self. But somehow along the way, we lose that, and we start doubting ourselves, and we deny ourselves, and we have other things that we are paying more attention to our own bodies. And so we lose this kind of connection, a mind-body connection. And so one thing that I want for, Black birthing people and Black women who are considering motherhood is to start to reestablish that connection. Listen to what's happening to your body. How are you feeling? Are you tired? Go to bed.
Yeah.
Stop trying to push through everything.
Stop.
When you eat this kind of food, how does it make you feel? What is the feedback? Do you feel gassy? Do you feel bloated? Do you feel constipated? Versus when you eat other foods, are you feeling good? You're feeling nourished. You actually feel full. And not like hungry again 2 hours later. So there's different kind of, biofeedback and all these other things, but just like being able to be in touch and listen to your body is something that I think we need to really start to reclaim.
No, I love that. That is literally foundationally, for me, it is about reconnecting people to, first of all, understanding that your body's speaking. It's the number one test. I always say, before you get any labs, you're the number one test is what your body is telling you, right? This is not to say don't get the blood work, all of that, but also, number one, be very in tune with what your body is telling you, right? If you eat something and you feel bloated, that's an inflammatory response. That's your body saying, we don't like that.
Not it. Right.
Right. That ain't it. Right. But the biggest thing I find, Dr. Tia, is that there is an environment, right? This world around us is basically saying, no, don't listen to your body, especially when it comes to, you say, well, I'm in pain. Well, that's normal, right? It's this normalizing of pain, which has now, and then the dismissing of voice. Well, something seems wrong. No, you're fine. How many times do you listen to that until you start to now dismiss yourself, right? And that, for me, that is where there is a real brokenness. And really, that's where we have to say, you know what? I need to, first of all, be the expert on me, and then find the people who resonate and understand and respect that. I know for you, especially because I've heard you speak about it before, right? How this intersection of joy and trauma, that we work tirelessly to conceive, to conceive families we desire to have. And then we work hard to just survive childbirth and then just to raise them, right? And how it seems that we know that gynecologically there is this disconnect with the respect of the Black woman with how it was founded. Talk to me about, how was this a driving force for you in your career? And, what for you drives you in the kind of care you want Black women to have?
Yeah. I mean, I feel at a very basic level, Black women just deserve good care, and it's good quality care. And it's the same heightened level of care that I want to give everybody. And so if I'm the equalizer who's out here making sure that everybody gets good care, then that's important to me. It shouldn't be, different in a way that is, negative or disparaging or dismissive. How about we raise the bar for everybody? And you really, you raise the bar by making sure that Black women have what they need. We have shown this, through the ages. It's when you kind of elevate the position of Black people, particularly in our country, United States of America, everybody benefits.
Everybody.
And so this is no different. Once we look back years from now at the impact that, Black Maternal Health Week have, the kinds of programming that's going on, the kind of legislation that's happening as a result of this awareness, we're all going to benefit.
Oh, what is the, knowing the origins, and maybe you could speak a little bit to it, of, gynecology, Marion Sims and all that. How did, and that disconnect in terms of what it did to Black women and how it's framed things for Black women. For you, how do you, first of all, work to educate your peers, right? Because I know that also as a Black RE, you're not the majority, right? You're the minority. And then working with Black gynecologists as well, right?
Yeah.
So obviously it's not, I know it's not for you to literally educate everyone, but how do you deal with that?
Well, Black women make up about 2% of the physician workforce. So we actually are in the minority. But interestingly enough, in women's health, in obstetrics and gynecology, more and more we are, kind of diversifying the field by leaps and bounds. It's probably one of the most diverse fields in terms of the young people coming out and going into this field. And it's one of the most female dominated fields increasingly. And so these are all good things.
Good.
I think many young trainees are understanding the need. They have a connection. They want to help. I have so many, Black OBGYN girlfriends across the country, across the city.
Love it.
They are just doing incredible things. And so those are the things that really kind of like propel us forward. We definitely have a difficult history in this country with the presence of Black people being here for slavery and intentionally being made to kind of procreate for, profit. And that legacy kind of lasts with us until today. And so that's something that definitely plays in the background in terms of our interactions with the healthcare field. But I'm really hopeful in terms of who we have on the front lines, who we have, in C-suites, talking to friends who are, executives and boards and chairs at different hospital systems and really making a significant difference. I think that's really what it's about. It doesn't mean that it's not hard. It doesn't mean that it doesn't take a lot of work. We're obviously on a call at 8 p.m. on a school night.
Right.
Okay.
On a school night.
And so it takes a lot of work to do the kind of things we do. But I think a lot of people really do it gladly and lovingly because we care.
Yeah. And we know that this is going to affect generations to come, right? We're trying to build a better tomorrow, literally today and tomorrow, right? I'm sure you heard of the story of Jessica Petway. And, that hit so hard because it seemed so senseless and preventable. What were your thoughts about it?
I was truly heartbroken. I was heartbroken. One is someone who's just a consumer on social media and followed her. And I was like, to see her face flash was like, whoa, this is what happened here. And to get a little bit about her story and the story in her own words and what's been circulated about this misdiagnosis is really heartbreaking. I have very good friends who are cancer doctors and they're just beside themselves that these things continue to happen till this day. And so I think the biggest thing that we want to make everyone aware of is routine gynecologic screenings. Cervical cancer is probably one of the more preventable cancers because we have a way to screen for it. It doesn't mean that that's going to get every single case of cervical cancer ever. But by, interacting with the healthcare system, getting pap smears, having what we call a pelvic exam where someone is kind of physically looking into the vagina and doing an exam there, it really makes a difference over time. I know sometimes you get busy in life, particularly after you have kids. Or if you're moving, you change jobs, you lose insurance. There's so many different things that can actually kind of keep us from getting the care that we need. But it really is, to our benefit to kind of re-engage. I was just talking to a crowd and saying, like, so many people fell out of care because of COVID.
It's true.
Things changed. People lost jobs. You don't have insurance. You move. All of these different factors.
And there was a period where nobody wanted to go to the doctor because it was
or the doctors were saying you can't come in, or they got so wrapped up because we had closures. But now is really the time to get back out there. Cervical cancer screening, breast cancer screening with mammograms starting at age 40, colon cancer screening. Colon cancer is on the rise amongst people younger than 50. And I've known so many people being diagnosed in their 30s and 40s. And so, again, listening to your body, getting those screenings, doing the follow-up, and then having conversations like this to make sure that, sometimes sister girls will tell you, like, that doesn't sound right. That's what they told you when you went. Maybe you should see my doctor, or maybe you should go here, or maybe you should go there. So there's an absolute kind of, importance of community and sharing and talking about it.
Yeah, 1,000%, 1,000%. And what concerned me, so just for anybody who may not have heard of Jessica Petway's case, she was a beauty and fashion and natural hair influencer. They call her one of the OGs of YouTube in terms of, natural, and with your beautiful afro, your beautiful curls, she definitely was a trailblazer, right? And she had two beautiful kids, I think 3 and 10 were the ages, right? Are the ages. And she was diagnosed with fibroids in 2022. And then she proceeded to have very, very severe symptoms of severe bleeding to the point where she even passed out in her tub, went to the ER numerous times, and then finally was diagnosed with cervical cancer stage 3 when someone took a look at her cervix. Now, Dr. Tia, so many questions. And I know we don't know the exact details of her case, right? But she chronicled it pretty well. How do you get diagnosed with fibroids and someone doesn't look in your cervix?
It beats me. I can't, speak on it because I have no idea.
Because even if you're doing a transvaginal,
I think, it's unfortunate. We don't know the particulars about who she was seen or where she was seen or what was done. I remember seeing a video about, things being explained to her. It's truly heartbreaking because these are the kind of missteps that we don't want to see happen. We want to empower people to kind of have trust and to be able to engage properly. This is really a truly unfortunate event.
Yeah. And then when you turn to your community and your community says, I'm passing large clots too. Like, no, that's not normal. It's not normal.
One thing I think of for you, because I know you have a daughter, and one of our dear friends, Regina Townsend for the Broken Brown Egg. She's a librarian by trade, but she really is like
love Regina. Hey, Regina, we love you.
We love you, girl. She always talks about, stopping this cycle of, women not having knowledge about their reproductive health, and how she talks to her nieces and goddaughters and young cousins about their body. And that kind of reminded me of that, because for someone to say, oh yeah, that happened to me too, it's like, no one should have kind of outcome.
No one.
Thinking about the amount of pain that is tolerable for a period. And, if your young child, a daughter, and even in high school is having the kind of pain where she has to stay home from school, that's not okay.
Not okay.
And, I think as parents, we also have to say, like, okay, this is out of the ordinary. This is extreme. If you can take pain medicine, that's sure. But like, let's see what's going on. Let's talk to the pediatrician. Should we see a gynecologist? Should we figure out what is causing this issue, instead of saying, oh yeah, all the women in our family have it? Or
that's the worst.
Biblical explanations about, oh, well, this is kind of how it is, because it really shouldn't.
It's not. And I talked about how when my daughter had her first menses, we had a period party, right? And it's funny because she's still squeamish about this stuff. Like, I make sure she has an app. She has the Ween, is it called Tina app? The Tina app.
Okay.
And it's very age appropriate. It doesn't because I looked at apps and a lot of them had, okay, did you have sex today? I'm like, she's 10. Okay. Well, now she's 12,
Right.
but, so I was like, I don't need her reading about this,
Right.
but it's very appropriate. And we go through like, how do you feel? What's your mood? And then she's like, okay, how long has your cycle been going on? And okay, let's look at, are you under a lot of stress? And never, if it's no, hold on a second, let's pull back. And then the other thing I talked to her about is how, diet and sleep and stress all affect your hormonal balance.
Absolutely.
Right?
Yeah.
All affect your hormonal balance, right? So for us, it's making sure she has the right supplements. We have a hormonal balance supplement called Balance, which is a period reliever. Like we make sure that her sleep and her hydration is proper.
Oh, for teens and tweens, sleep is paramount. They need as much sleep as newborns.
It's
Nobody
terrible.
thinks about that, but they need a lot of sleep.
And this is the thing. When they're living on deprivation of sleep because they think that they don't need the sleep, it all has a cascading effect, right? So understanding that it's a new normal, and that it's like, I feel like I said it yesterday. I said, I feel like preaching these messages, telling people these messages all the time. And that's why I'm so grateful for the allyship of physicians in the medical community that have an integrated mindset, right? Because there are some that are like, oh, none of that matters. Oh, it's all normal. I'm like, what? No. Okay. And then it's like, it's like you're trying to sweep up the sand on the beach, with a broom. Right. You're like, but everybody's saying the opposite. No, it is not normal. I don't care who tells you heavy bleeding and painful periods are normal. It is not normal, right? And if we start there, if you start there and we think about what made her say to the point where she was bleeding in the tub, right? That, wait a minute, I'm not ringing the alarm that something the house is burning down, right? The house is burning down. Go see another doctor. So, I appreciate that, your messaging and your work speaks to that mind-body connection.
Yeah, I think that's the next frontier for us. We have to be in tune. You have to get back to being able to trust your body.
Yes.
The signals are there, the bowel signals, bladder signals, pain, pressure.
I record my bowels every single morning. My poop.
Like all these things. Oh, there's a lump here. Oh, I'll just, just getting more in tune, slowing down, I think is a big part of it. The world is go, go, go. We're not well rested. Is another big part of it, and being able to move your body appropriately and really kind of nourish yourself appropriately will kind of give us that space back to really take care of ourselves the way we should.
It's like reassembling the foundation. The foundation is a sense of self. The foundation is self-care, right? And that has just been pulled apart, right? Especially for us coming from the lineage of history of our history in this nation. Self-care was not even, not even a realm of possibilities.
Yes. All, right? And so now we kind of have to flip it on its head, where you actually come first, because, they always say you can't pour from an empty cup.
Right.
Well, you won't be able to do any of this if you're not here.
That's right. That's what, literally. So I want to, be mindful of our time and our children, even though mine is literally on Broadway right now.
Oh my God.
Shout out to Nia, Authentic Nia, performing in The Lion King right now. And that's another thing. She doesn't get home till 11 o'clock at night. She has a night job, but listen to this. Because she has a night job, we pulled her out of school and we gave her private homeschool teachers, right? Yeah. So that she can sleep later in the morning.
Oh, of course.
And she can have school like 10 o'clock instead, so that she could still get rest.
Yeah, that's important. I mean, it's incredible.
You're going to have an incredible opportunity like this. We want you to thrive and flourish through it. not be crushed by it.
Right.
So what would you say to a patient struggling with anxiety of childbirth? How would you support her? Because I know this is a conversation.
This is definitely something that comes up pretty much every day, if not every week. And, I think about a lot, particularly in a week like this. I think the first thing is to, just know that our bodies are capable, right? You can do this. You are designed to do this. The second thing is to start to draw your support. Who are your people around you? Who's your village is what I literally
Yes, that's right.
Your village. If it's your partner, is it close friends? It might be new friends. It might be mommy friends who, who've gone through this and who can provide the support because they've been there and they know what you need. It could be coworkers. We find support in lots of different places. Neighbors, people who maybe weren't traditionally your go-tos, but now maybe because they fit into your life in this new way. And so I think being able to kind of build your village around you, who can be a help to you, who can be your shoulder to lean on, who is your person who prays with you, who's your person who can help you run some errands when you're feeling run down, or who can pick up your big kids when you got to go to the hospital for a new pregnancy. There's all these different things. And so it's not being ashamed to ask for help, obviously, but
you deserve support.
Reaching out to those people yes, you need support. Some people are going to have to hire help. And so that's something also
unashamedly
that we shouldn't really be ashamed for. No.
Right.
If you need someone to help watch your children or daycares or extended care, someone to help you clean your house or clean your car or run errands or buy your groceries. Or cook food for you. These might be things that you need to kind of create the balance and to again, give yourself the care that you need.
So self-care being the foundation, what does self-care look like when you have no children, you're trying to conceive? I heard you talking about this with Dr. Camille, one of our dear friends.
Yeah.
When you're trying to conceive and you're in these very triggering places and times, what does self-care look like?
I think it depends. It's different for different people. Some people can engage in those spaces and be okay. Some people might be through a season where they have to kind of withdraw and shield themselves. I think setting boundaries is completely reasonable. Everyone's not going to understand it, but at least you communicated it.
Right.
I think if there's something that's particularly, hard for you, a baby shower or a child's birthday party or Halloween even can be a big one, or Easter, because it's a kind of like kid-centric, holidays. Speak to the host, speak to a person who's, invited you out. You can let them know as much as you want or not want, but I think being honest with it actually helps to serve us all, because one, we need to know that this is around us.
Yeah.
We need to know that there are people who are
first,
working and struggling and in our communities, in our churches, in our sororities who are going through these things. And you can offer how they can support you or not. You can just also bow out and just know that that is your thing that you have to do for yourself. I know it can be hard. It gets very political. You didn't come to my baby shower, but that's fine. If that's what you had to do for that season. That's why I say just communicate so that, people don't feel like you kind of just up and left. But just know that that's okay to do that if that's what you need to take care of yourself.
Yeah, I think that's critical, is that understanding that your first responsibility is self-care. And, obviously every situation is not the same, but if somebody's close, having a conversation with someone close, it may hurt them, but they'll understand. Right.
Yeah.
And knowing that you're worth that support, right? You deserve support.
Yeah.
And then, the leading cause of maternal deaths it isn't hemorrhage. It's actually cardiac events, right? Like heart attacks. How can women be better equipped for childbirth, in your opinion?
Yeah, so the top 5 causes for Black maternal death are cardiac and coronary events, VTEs, which we call venous thromboembolisms, like blood clots in your lungs or legs.
Right.
Hypertensive disorders.
And a lot of those blood clots, happen sometimes after birth too, right?
Yes,
like
that's actually your highest risk.
The highest rate, highest time is after postpartum. Mm-hmm. And that can also, I'm sorry, because I remember how that can be actually evidence is bleeding, because this is important. There's sometimes women can be told, oh yeah, the bleeding is normal, but it's really heavy. And if you're feeling like it's like, don't just let it, don't ignore it. If I know people who unfortunately it did not end well because it was a clot. It was something that took their life because they did not. So what have you had experience with that?
So hemorrhage after delivery in the postpartum period is real. The majority of hemorrhage happens soon to pregnancy or soon to delivery, like within moments to hours or days, like maybe before you leave the hospital. You can still be at risk of hemorrhage once you get home. And so, like you said, the bleeding after delivery should be like a heavy-ish period. If it's heavier than your heaviest period day, if it's soaking through a pad, through clothes, if when you stand up, you feel faint, like you want to pass out, not normal. You have to get back to the hospital right away. The blood clots that happen in your legs and lungs don't cause bleeding, but the biggest symptom that they cause is shortness of breath. So it's hard to tell because you get shortness of breath from a lot of different things after having a baby. You can have it from actually what we call cardiomyopathy, which is kind of weakening of the heart as a muscle due to some of the stress and strain of pregnancy. You get it because you're carrying so much weight and more weight than maybe you've ever had before. And so after delivery, there's a lot of extra blood and fluid that was nourishing the baby in your uterus now has to kind of find its way out. And so it can manifest as fluid in your lungs and legs and make you very puffy and also kind of make it hard to breathe. But those things are the ones that we watch out for the most. If there's a sudden change in how you're feeling, breathing, if there's a real increase in how tired you are, the biggest test is a flight of stairs. If you have stairs in your house, even after a delivery, you should be able to kind of make it up the stairs. Maybe you're limited by pain. If you're limited because you can't catch a breath, that's different. And that's why we want you to go back. Sometimes in your legs, we can see it as swelling. Typically, normal swelling after delivery should be equal. It should look the same on both sides. If one side is huge and the other side is not, if that side is hot,
and painful too,
into your skin, it makes a dent that stays there. Those are the things that we definitely want to have investigated because it could be a sign of something much more serious.
So number 1 was cardiac event. Number 2 was blood clot. You said there were 5.
So, cardiac event, cardiomyopathy, which is that kind of stress and strain on the heart, which happens not infrequently. So
that's 1 and 2?
Yes. Those 1 and 2. Hemorrhage is another one.
Well, you said 3 was DVT, right? Blood clot. 4 is hemorrhage.
And then the last one is hypertension.
I was going to say preeclampsia.
Preeclampsia kind of goes into this bucket of hypertensive disorders of pregnancy. And so a lot of those have cardiovascular implications.
Right.
And so that's
very interesting. They are all like connected, right?
So it's all the more reason to start pregnancy in as best of a health kind of, position you can. If you are struggling with high blood pressure or diabetes, let's work on that and let's make sure that it's controlled. If you have an underlying cardiac issue, then you may need to talk to a cardiologist prior to pregnancy to figure out, what's the best regimen for you to be on. Sometimes for some women who've maybe been dealing with high blood pressure for a long time, I actually send them for a cardiology evaluation so that their cardiologist is aware. We can do an ultrasound, we can look at the heart, we can do EKGs and make sure that everything looks fit prior to pregnancy. Because pregnancy really is an endurance event on your body. This is like a marathon. This is like
I was just going to say, what's that thing, Iron Man? It's like an Iron Man, right?
It's like a 10-month Iron Man. And your body has to be in tip-top shape in order to be able to kind of make it out unscathed. And that doesn't mean if you're entering a pregnancy, with a medical issue that you'll have a bad outcome. We are trying to reduce the risk of these bad outcomes.
Reducing the risk. That's really important. I had a post earlier this week and it literally was about that. Like our number one job is to make sure our overall health, right? Chronic issues, one of the things that women, because of the work that we do, we focus on prevention, right? So D3 levels amongst Black women, it's just sky high, obviously, deficiency, D3 deficiency levels, and how it's connected to so many issues, right? Because of how it's one of the major hormones the body uses to fight inflammation and tumor and so many, so I say to people, like, okay, number one, see your primary care physician, right? Get a real workup of what it is, what's going on in your blood work. And the other thing is, being told that your D3 level should be, when it says 30, that's just normal because it's the low normal. No, that's not going to help you in terms of fighting your immune health, your cardio health, everything. No, it needs to be higher in the 50 to 70 range so that you have high normal, not low normal. That's like, just give me the minimum to get through the door. No. Black women, we as Black women, we need more than that, period.
Some people are going to need vitamin D supplementation because our darker skin does keep out what I was more of the sunlight. We also just don't, we're not, even things, some foods used to be fortified with vitamin D, and a lot of people aren't consuming those kinds of things. And so, I think it's something definitely to ask about if you're going to see your primary care is like, what is optimal for you? And, I think a big thing too is to make sure you're disclosing what kind of supplements and vitamins you're on, because people are taking so many different things these days that you just want to make sure that it's not going to interfere with any other kind of medications or something like that you need to take.
Absolutely. And if you're consuming ganja or anything else, everything, period.
Disclose it. Make sure, be honest.
It's your health.
I wish I
put it all on the table.
It was a judgment-free zone. That might not be the case. But it is important in your overall, kind of landscape to know what all is in the background, and you talk about it honestly and kind of move forward from there.
So do you have, since I brought it up, do you have patients, like when you're talking about fertility, right? I was talking to Dr. Lane, I was on a fertility IG Live last week. We were talking about how smoking kills the good cells, right? Like the good eggs, and how in terms of how weed is known to impact fertility, right? Is that like something that people, and she even said how one person said, it's not just one person, actually several clients. They were like, we want to do IVF because I don't want to stop doing, I'm not giving up my weed. Like that, which is interesting to me. Obviously, everybody's, you got your own life to live, but like, it's interesting that they got choices to make, but, so thank you so much. Everyone, please, first of all, we didn't say, but Dr. Tia Jackson Bey is in New York. I refer clients to her who are, looking to advance their fertility and also to examine and explore their fertility options, right? I want people to start on that spectrum as soon and as early as possible. She's right here in New York. Do you want to tell them where you work and how to contact you?
Yeah, absolutely. So I think you can find me here on Instagram. If not,
just click her, follow her. That's number one.
Right.
Follow
and
her.
Then link in my bio, you can call and have anything. I'm at RMA of New York right here in Brooklyn. So my office is in downtown Brooklyn. I'm there most days of the week seeing patients. And so absolutely happy to see anybody who's interested in kind of like a fertility checkup, check-in, if you're suffering from uterine fibroids, endometriosis, PCOS. If you are trying to get pregnant and it has not happened, please come in and let's figure out what's going on. And also, if you're curious about things like freezing your eggs or freezing embryos, or told you need a big surgery and, wondering how that could impact your future fertility, then we can absolutely talk about that.
Awesome. Thank you so much.
You're very
for finally having this conversation. And it won't be the last one. There will be more.
That's right.
Exceptionally awesome. So thank you for all the work you do. And thank you for your time tonight. I appreciate it. And you hit the X and you can have a good night. Because I know you, I kept you longer than expected.
That's fine though. Thank you so much for having me.
Thank
have a good
you.
One.
Thank you, you too. So everyone, thank you so much for joining us tonight. I am truly, blessed to do this work every day. I can't tell you how honored I am to, number one, to help you experience and this joyful, healthy life that you deserve, right? That's what we do here at the Detox Now. We're here to support you in knowing better, doing better, so you can live better. So you're not alone. Whatever you're going through, we want you to know you have a tribe of people who are here to support you and helping you make the right decisions, helping you determine the right plan for your health. If you are dealing with heavy cycles or dealing with some sort of chronic issue, you know, we're here to help you, support you in making the right plan for you, as I said. So take our free quiz at thedetoxnow.com. It's right at the link in my bio, thedetoxnow.com/quiz. And, or you can book a free consult with one of our coaches or nutritionists, and we can help you in supporting you with making the right plan for you with your doctors and your team. Just know that there's power in your hands. That's the biggest thing. And I love what Dr. Tia talked about, is really helping you reestablish that mind-body connection where we are listening to what your body is actually saying and doing what's in our power to actually achieve optimal health. That's what we do together. So thank you again for tonight. And this is Coach Gessie. Good night.